In pharmacology, we study the effects of different medications on the body. And to really understand how pharmacology works, you have to understand how pharmacodynamics work and pharmacokinetics. So there's a difference between both of these pretty complicated terms. And we're going to zoom in and start with a really simple definition of both, which is pharmacodynamics is what the drug does to the body, while pharmacokinetics is what the body does to the drugs. So how does this work in practice? If we look at pharmacodynamics, we're going to ask the following questions. We want to understand maybe what receptor does it bind to? And how does it bind to this receptor? We want to ask in what kind of tissues does it have an effect? And what kind of pharmacological effects does it have? Is it a painkiller? Is it an anesthetic? What's it doing? How is it working there? We want to know, how does the dose influence this effect? We'd like to know, what is the minimum dose that we need for this medication to be effective? But we also want to know, what is the maximum dose that we are willing to give of this medication without too many side effects occurring? So this is what we're going to focus on with pharmacodynamics, really in depth. What is the drug doing to the body? On the other hand, pharmacokinetics, so we look at what does the body do to the drug? And so here we're going to ask the following question. How does the drug move through the body? How is it absorbed? How is it distributed? How is it, if it is at all, metabolized? And how is the drug excreted? These are going to be our main four categories that we want to discuss when we're talking about pharmacokinetics. So this is really useful to remember this ADME, ADME, absorption, distribution, metabolization, and excretion. And we would want to ask here, what is the half-life of the drug? So how long does it stay in the system, really? How long does it take for this drug to be broken down? So how is our body working through this drug, taking it in, distributing it, metabolizing it, and then kicking it out? Well, again, for pharmacodynamics, we are looking at what is the drug doing to us, how is it binding anywhere, how is it causing this effect, and how can we use the dose to influence this effect? And now you know the difference between pharmacodynamics and pharmacokinetics.